Hello, this is David Katzka. I'm one of the GI consultants at the Mayo Clinic, Rochester, Minnesota, and we're happy to report on our study for GIE entitled Comparison of Mucosal Impedance Measurements Throughout the Esophagus and Mucosal Eosinophil Counts in Endoscopic Biopsies in Eosinophilic Esophagitis. This is a study that was done in cooperation between our investigators at Mayo as well as at Vanderbilt University, where this novel impedance probe is being used. So the main question is, why did we first initiate this study? And the reason we did is because, as you probably know, there's a bit of controversy now swirling around the concept of whether measuring mucosal eosinophilia is the only or most important endpoint in assessing activity in eosinophilic esophagitis. As you probably know, when you take biopsies from patients with eosinophilic esophagitis, the distribution is often patchy. We may find biopsies which may have 5 eosinophils per high power field, and then another biopsy with 80 eosinophils per high power field. And it becomes a question of which one is a more reliable marker of that person's esophagus when assessing EOE activity. It may not be surprising also that mucosal eosinophilia may not give us the whole story, because after all, taking 6 to 8 biopsies in a patient with EOE is assessing less than 5% of the entire esophageal mucosa. And hence our feeling, as well as our colleagues at Vanderbilt, to use an instrument which may more globally assess esophageal function than just taking 8 random biopsies. The device that we use in this trial is called a balloon impedance probe. And what this does is it measures impedance throughout the esophagus. This impedance measurement is no different in a sense than what we do on 24-hour pH impedance monitoring, except that now the impedance probes are flush against the esophageal mucosa. So just as you may read impedance in an overnight study during the wee hours of the morning to determine mucosal impedance, which has been done in several studies, we are now more precisely measuring mucosal impedance throughout 2/3 of the esophagus. And now we'll show you what this probe looks like. We'll now show you the impedance probe. On my left is Deborah Gino, who's the head research coordinator for our esophageal interest group, and who has been pivotal in performing all these studies, and certainly is one of the foremost experts in knowing how to perform and interpret these studies. Deb, shall we show them the probe and how it works?
So this is the probe, the impedance probe. As you can see, it's marked by centimeters. So Dr. Katzka, after he does the endoscope, he measures where the G junction is, and then we place the probe. So we usually inflate for our narrow esophagus for patients with EOE to about 5 psi.
Here's the probe suspended in air. Here are the electrodes. We have 10 electrodes on one side of the balloon and the other side of the balloon. Again, this passed through the esophagus, so measuring at least 10 centimeters of the esophagus. And simulating as if we were in contact with fluid on the esophageal wall or in the lumen, as we dip this in, we now see the impedance change. And that's because the bottom of the balloon, suggested by channels 1, 2, 3, and 4, is suspended in water. Hence the current flows and the impedance drops. Similarly, if I take it out and put it in air, the impedance will change. To show something perhaps more physiologic, I'm going to take one of the strips, but not the other, and place it on my tongue. So what you should see, because of the mucosal surface, the fluid, the conductivity among cells, the impedance should drop. And then when I remove, it goes back to infinite impedance. Here is an example of an impedance color plot for a patient with eosinophilic esophagitis. One can notice on the left channels 10 through 1, proximal to distal, left and right, and the various numbers which are measuring the impedance from probe to probe within the esophageal lumen. On the right is a pure color plot summarizing this data in graphic form. Notice specifically how much of the plot is red, implying very low impedance within a patient's esophagus who has eosinophilic esophagitis. In contrast, here is a measurement from a patient with a normal esophagus. One can see that the numbers going from proximal to distal, left to right, are in a much higher range, typically above the 2300 level, and the colorimetric summary on the right now shows the predominant mucosal pattern of green, which represents normal impedance. One of the questions is, of course, what are we measuring when we get these impedance values? And as we discussed, similar to other pH measurements with an ambulatory catheter, we are basically measuring the cell-to-cell spaces in terms of how well electricity is conducted in the epithelium of normal patients and patients with eosinophilic esophagitis. Because patients with eosinophilic esophagitis characteristically have dilation of the intercellular spaces as one of the pathologic hallmarks, we assume that this contributes to increased flow of current in this water and electrolyte-rich fluid, and therefore yields lower impedance and higher current. Indeed, experiments from ours and many other laboratories have shown that this finding of dilated intercellular spaces and mucosal impedance correlates very well as a surrogate for disease activity, pathologic changes, and even mucosal eosinophilia. One must ask then, why should we do this instead of biopsies? And as one can see, even in the pattern shown here, there's a patchy distribution of colors, either the normal or the patients with EOE, suggesting again that it's probably a conglomerate view of the esophagus in toto will be much more accurate than patchy biopsy findings that we tend to find. And we're hoping, because this reflects diffuse mucosal permeability issues as opposed to patchy eosinophil distribution, that this in fact may be a more reliable marker of disease activity than what we've used so far just on biopsy. The hope, of course, and the next experiments are now to use this as a therapeutic endpoint and correlate indeed with our other measures of EOE activity, such as the EREF scoring systems and other pathologic findings, to see if perhaps this is just as important an endpoint with which to use to treat and assess activity in patients with eosinophilic esophagitis. Thank you so much for listening to our video.